capsule is. Look how nice it is. It's not nodular. It doesn't have tumors or bumps. Here's a nice falciform ligament. Here's probably parts of the coronary ligaments. Notice that this liver is not as brown as it should be. In fact, it is kind of more yellow than it is brown. And here's an area here that is almost predominantly yellow. Let's take a cut through that liver. And sure enough, it is quite yellow, isn't it? You might have looked at the surface of your knife as you cut through it. Maybe it was kind of greasy after you cut through it. Maybe the surface itself looks a little greasy. Also notice that if you look very carefully, all of these little red areas here are probably central veins, and they have a rather uniform semi-hexagonal type arrangement. So you would not guess that this is cirrhosis, not only from the fact that the capsule was smooth rather than nodular, but even when you look at these little central vein areas, here, this is still kind of a normal hexagonal portal architecture. Let's look at it microscopically. Wow. In the other two fatty livers, we guessed maybe from 10 to 20 to 50 to 60% of the liver cut section was fat. Here, I would probably guess that if you dissolved all the fat out of this liver chemically, it might wind up being 80 or 90% of the liver weight. But notice that even though this liver is terribly, terribly overloaded with fat, which is what all these spaces are, predominantly macrovesicular, but you know some of these little vacuoles within cells are microvesicular. Notice that even though it's overloaded with fat, the so-called portal hexagonal architecture is still preserved. This person may not have a tremendous amount of liver disease functionally. On the other hand, if the fatty liver can extend and be allowed to exist for long periods of time in such a way, you'll see that there will be some fibrosis around these portal tracts, extending to other portal tracts. And once you have an area of fibrosis extending from one portal tract to another in such a degree that the normal hexagonal architecture of the liver is disrupted, then that's cirrhosis, isn't it? This is perhaps a very, very early cirrhosis or portal fibrosis, but I'd have a hard time calling it cirrhosis myself. Thank you very much. But notice that in this liver, it's not quite as pink as it usually is. Well, is that because the technician forgot to put in enough eosin into the stainer? Or is it because a large portion of the cells are vacuolated? Well, I think B is the correct answer, because look, here are hepatocytes, and notice that within the cytoplasm of the hepatocytes, there are these small, cleared spaces which represent fat. This is a fatty liver. Very often fatty livers are divided into microvesicular versus macrovesicular. A microvesicular liver is one in which the fatty spaces are within the hepatocytes, basically all these small little fuzzy areas here, and they are small, so they're called microvesicular. In a macrovesicular, the fat spaces are big enough to be actually larger than liver cells, and they may be quite huge. And I think we could say, although this is predominantly a microvesicular fatty liver, there are some big fatty globules out here which are much bigger than cells, and they're not completely within cells. Oh, here's some more out here as well. Main overwhelming commonest causes for fatty liver statistically, diabetes, obesity itself, as well as alcohol. There are a variety of other toxic compounds besides alcohol which cause fat in the liver, but alcohol is without a doubt the most common. See these little fuzzy things within the hepatocytes? Those are microvesicles. You see these larger things out here which are bigger than cells? That's macrovesicles. Also notice that this liver, even though it's loaded with fat, maybe half of its weight is fat, if you can estimate that from the cross-sectional area, it still has a preserved architecture. It's not cirrhosis. There's no increased fat. And if you go and try to find portal areas every now and then, you will generally see that they are arranged in a relatively hexagonal array, which means the architecture is preserved. This is fatty change, also called fatty morphosis, also called microvesicular versus macrovesicular fat, also called fatty liver. Thank you. When you look at a liver on low power, like we are here, it's really not much different from looking at that liver grossly. Because when you look at a liver grossly, you see liver, which is brown, and then you see little spaces between them, which are some type of blood vessel. If grossly or microscopically, you can see that some of these vessels, which are all veins, by the way, have arteries with them and bile ducts, you know that's a portal area. If, for example, a vein appears to be all by itself, that's more likely to be a hepatic vein. And if a vein, for example, appears to be in the middle of a lobule, and is small and has no connective tissue around it, that's very likely to be a central vein. But if you see a vein which is accompanied by an artery and a bile duct, you know that that's the portal part of the lobule. If you see a vein by itself, that's the central vein. This is a normal liver, and I cannot emphasize how important it is to get a feel for a normal liver, because until you have a good visual image of normal histology, normal gross appearance of a liver, you'll never to be able to understand all of the diseases that affects it. This is not the world's best, most classical normal liver. There's a little cutting artifact here. There's a little crack artifact here. And it looks like it is really a reasonably good piece of liver, like the kind you might expect to see just about anywhere. The thing that your mind has to understand, however, is that when you look at these lobules, and if you generally understand that the portal areas are kind of hexagonally arranged around them, and the central vein is in the middle, and that pattern generally extends throughout the whole liver, then you'll have a good feel for it. In reality, however, in the real world, you will hardly ever see a lobule in which you have 6 nice portal areas arranged like a hexagon around the central vein. That just doesn't happen in real life. That's only what your mind has to imagine conceptually. Another thing that you can rely on is that if you see a vein and there's absolutely no connective tissue around it, you don't have to sit there and wonder whether that's a portal vein or a central vein, because all portal veins are in portal areas, and all portal areas have connective tissue around them. And all portal areas, besides having a portal vein, will have a hepatic artery and a bile duct. You probably will never see all 3 of them in many of the lobules. Sometimes you will if you're persistent, but you can see there's a little artery here. You can see there's a vein here. And you can see maybe this was part of a bile duct. Let's go up 1 more power and prove this is a portal area. But even if you don't see all 3, if you see connective tissue around a vein, maybe an artery, you know that's a portal area. Here's the duct. Here's an artery. Here's an artery. Here's a little artery. And here's the vein. This is the world's most classical portal vein, portal triad. And it's not inflamed. It's well delineated from the surrounding cords of hepatocytes. And it doesn't look like anything at all like a central vein, because in a central vein, you only have the vein and no connective tissue around it. And if you could imagine that these hepatic cords and the sinusoids in between them are kind of converging towards these central veins, originating ultimately from all the surrounding portal areas, then you have a real good conception of the normal liver. And even though I have presumed you generally all have a good working knowledge of general histology in order to understand pathology, you have to review your normal histology all the time. And if you have something imprinted in your brain like this, then the reviews are quite quick and easy to understand human disease. Thank you very much.